If you have been diagnosed with a Morton's entrapment or Morton's neuroma, please review this short PowerPoint so that we can make sure you fully understand what is involved with this procedure and how to manage your postoperative care. In this slide, we can see an illustration showing the nerve that's on the bottom of your foot as it courses out from your foot out into your toes. The transverse intermetatarsal ligament is a very rigid ligamentous structure that when your foot flexes while you're walking causes an impingement or an entrapment of the nerve. This is the cause of the problem. It is not a tumor or a neuroma, as the term neuroma really means that a nerve has been cut previously or injured previously, and that is the definition of a neuroma. This is a true nerve entrapment, and we address it as a true nerve entrapment. This illustration shows how we decompress the nerve that is entrapped in the front part of your foot. A small cannula is placed between the toes and underneath the transverse intermetatarsal ligament. This allows us to put a camera and a small blade inside the tube, visualize the ligament, and then cut the ligament. Because we have you weight bearing immediately, this ligament rarely heals back together, so the nerve will not become entrapped again. It is a very minimally invasive procedure, but as with all surgeries, it still needs to have the proper postoperative care. As with any surgery, there are potential complications. One would be infection. Infection rate is extremely low in foot surgery and even lower with minimally invasive procedures such as this. There can be injury to a flexor tendon, which would result in a decreased function of the toe during clenching. Although not a complication, failure to improve would require the patient to possibly undergo a second surgery that would actually remove the nerve. Painful scar tissue formation can be a complication with this technique, but it is again a rare complication. Patients will sometimes report the feeling of movement within their forefoot or popping between the metatarsal heads. This usually disappears after several months, but it is a potential complication. There is always the possibility that there could be injury to the nerve, which would cause a pain syndrome such as complex regional pain syndrome. Patients can usually remove the dressings the next day after they've had an endoscopic decompression for their intermetatarsal nerve. We will allow patients to shower regularly the next day, but it is important to remember you cannot soak or immerse your foot until about a week after the sutures are removed, which is usually about 3 weeks. Once the shower is completed, you should apply some betadine or povidone iodine to the areas and use small band-aids. Then return to a regular shoe if tolerated. You can start increasing your activity over the first few weeks to tolerance, but listen to your foot. If it's starting to hurt, then that means you're doing too much postoperatively. Most patients will note improvement very rapidly after the nerve is decompressed, but sometimes outcomes cannot be fully appreciated until at least 16 weeks after the decompression. Success rates are decreased if you have had previous steroid injections, alcohol or sclerosing injections, or some type of cryoablation procedure, because the nerve may already be damaged and decompression of the nerve may not restore full function and relieve all symptoms after this type of surgery. There are a small percentage of patients who will not get complete relief or have continuation of their symptoms after an Eden procedure. There are other things that can be done, such as a mini neurectomy, radiofrequency ablation, or even more advanced techniques like denervation with blind loop graft and transfer of the nerve. If you do have this continuation of symptoms, it's important to discuss the further options with your surgeon. Thank you for taking the time to listen to this informed consent, and if you have any questions, please reach out to us so that we can fully discuss this and you are completely informed about the procedure that you are about to undergo. Thank you.